I'm Eric Cohen. I'm the co-founder of National Sleep Therapy, and I'm joined by Doreen Brennan, who's one of our really super respiratory therapists, and we'll try to get through as many questions as we can. Very quick background on our company. We're actually a small company with a big name. We have a unique way of doing business in that we partner very closely with your sleep doctor, and we try to give you a seamless support network working in conjunction with the doctors. We work hard to support your CPAP and your CPAP needs, and I really hope that it shows. If you ever have comments or have suggestions or ideas, please feel free to contact me directly. You probably have my email address since I tend to outreach quite a bit, and a lot of times I just do it directly from my email. So it's ecohen@nstherapy.com. If you don't have it, feel free to contact me directly. So hopefully we have a good number of callers. What I'll do is go through some of the questions that you thank you very much for taking the time to send in, and then we'll open it up for some general questions if we haven't covered it. First, a quick overview. It's, as of very recently, within the last days, it's kind of hard not to start off with how the industry is rapidly changing, primarily driven by the need for lowering everyone's healthcare costs. So we're seeing this in a couple of ways, and some of you may have experienced this. One is in sleep testing. Many of the labs, many of you may have gone to an overnight sleep study. Many of the insurance companies are now requiring home sleep studies, as well as the reimbursement amounts for sleep therapy equipment, the CPAP machine and the masks and the hoses and all those things is going down quite considerably. So these things are changing the industry, and why this is important for all of us is because, one, with lower reimbursements, it can lead to fewer choices in who you get your equipment from, which we hope is not the case. We hope you love us and stick with us. But the manufacturers, of the machines and of the masks are investing less in research and development. And we're going to stay on top of all of these issues. We're going to find the best masks and the best machines and bring them to you as best we can. To do that, we go to all different trade shows and things around the country. We meet with manufacturers and sleep doctors. We try out the latest masks. We talk to the best doctors. We find out what works and what doesn't work. And we immediately share this information with you in our newsletters and in our emails. And, despite these changes, which aren't always for the best, we remain committed to always being available to support you in any way we can. And I'll get to how you can best reach us. That was one of the questions that we had. And as you might guess, the number one issue we face from an equipment point of view, and many of your questions, is with the mask and with the mask fit. And gosh darn it, why isn't there a mask that's perfect for me? And we'll talk a little bit about that. And we know that that's a challenge for a lot of folks. And even though we carry a very broad selection of masks, it's often difficult to find the right one straight out of the box. And for many people, honestly, there's no perfect mask. And often the right fit is a compromise or a combination of pads and liners and sometimes some just good old-fashioned ingenuity on your part. I've had and helped patients, don't let this get out too much, but sometimes we have to cut, we have to tape, we have to shape. I've helped people bend their masks using a hairdryer to fit their faces better. And sometimes these are the things we just need to do because everyone's faces are different. So let's move on to some of the questions. I don't want to take too much of your time. When we're done, I'll open the lines. We'll do some Q&A and have a little dialogue, and I'll thank everyone in advance for being well-behaved and quiet on the phone, etc. So, quick poll. Everyone can hear me, correct?
Yes.
Yes?
Yes.
Okay.
Yes.
So I'm just going to go down some of the questions in order. sort of in order that they were received, and I highlighted some ones that I think I've heard a lot of phone calls about. I've emailed people. The first one is, I travel, this is from Norman. He travels frequently on overnight flights. He's very interested in the developments in a new line of smaller battery-powered portable CPAP units, especially ones that have data recording capabilities. What do we have to offer now, and what can we expect in the future? And currently, for those interested in small portable units, I'll make two comments. One is there is something called the Transcend unit. It's available through National Sleep Therapy. It is a small unit. Some of you may have seen it. It fits in the palm of your hand. It can be run from a battery. It's a terrific unit if you're traveling, and you can almost put it in your pocket. It's so small. I know the cost is something like $480 or so. Don't quote me on it. It's something like that, plus or minus $10. It doesn't have a humidifier, like a water humidifier like our normal CPAP machines do. It uses a special mask with a special type of humidification in it. It almost looks like a wet sponge, and it passes when you exhale air, the moisture from your exhaled air gets trapped by this sponge, and when you breathe in, the air that travels over the wet sponge evaporates again and comes back in as humidified air. The other part of Norman's question was, what advancements do we expect by the way of compliance? And I know that the Transcend unit, they are working on a unit with compliance monitoring. My guess is that it will be with an SD card, similar to what we have in the Respironics machine, and you'll be able to download that somehow. So I expect that. My guess is that will be out in the next 6 months or so. So that's something to look for, and is easy to travel. Secondarily, I actually spoke with someone today about disconnecting the humidifier from your Respironics CPAP machine. You can basically cut it in half right down the middle by disconnecting the two. So if you just want to travel with the half that blows the air, not the humidifier, you can do that. I would test it without the humidifier before you go on your trip. Make sure you don't get too dried out from just the air without the humidification. And if it's okay, then you might want to just take half of it on vacation with you or your travels, and just that much smaller. So on to the next question. This is from Clifford. I feel you should be able to replace just the elastic headband with. I feel you should be able to replace just the elastic headband without replacing the whole face mask. I have a new face mask. I don't like it as much as the old face mask. Can I go back to the old mask that has been discontinued, or has this been discontinued? So yes, in fact, many of you may have received an upgraded full face mask that we sent in with your resupplies. About 75% of the folks that got an updated mask kept the update. However, if you do receive an upgrade, you can always switch back to your normal mask. All you need to do is call us or email us and say, I don't like this upgrade. I gave it a good shot. It doesn't fit. It's hurting my nose, whatever the issue, and we'll quickly get the other mask right back out to you. In terms of I should be able to replace just the elastic headband, in theory, yes. It seems like an easy thing to do. The way the masks come and the way they're packaged, they all come together, and for some reason the manufacturers don't package just the elastic head strap separately, which I don't know if that's a marketing thing or not, but that's the way we get it. It's not really possible to separate them and bill you separately because insurance doesn't really have different codes for it, and we almost have to operate in the way that the insurance companies will bill, and it doesn't always make sense. So I apologize if it doesn't make sense. It's sometimes just the way that we need to operate. So on to the next question from Garth. They're on a weight loss program, and the question is, if I lose enough weight, will I come off the mask? And the answer is, I don't know. And I don't know because for some, this can work. I have had plenty of customers who, if they were a little bit heavier than they wanted to be, and the extra weight was impacting their breathing at night, that can losing weight can help. I also know plenty of skinny minis who have sleep apnea. They're thin as a rail, and they snore like a freight train, and they have sleep apnea as much as anyone else. So it's not only people who might be heavier than they like that have sleep apnea. It's from one spectrum to the other. Your doctor will be able to guide you on that, but I have heard of people who have lost weight and their sleep apnea has gone away. I'll also mention that losing weight is also good for helping to reduce diabetes or the possibility of diabetes. It helps your cardiac health. It can help if you have high blood pressure. Everyone knows, weight loss is a good thing, and I would suggest that everyone talks to their doctor before going on a weight loss program. Next question, easy one. Who do we contact at National Sleep Therapy with various questions or problems, and how long should we have to wait for a response? Would it be possible to have one contact? Question from Paul, who I believe is on the phone. It's a very good question, and I hope I have a good answer. Personally, I'm an email person. Our company really likes email. It's very fast and it's very efficient, and you'll get very good service if you email. We have a protocol within our company that if you email us at support@nstherapy.com, that email gets dispatched to myself and about 6 or 7 other people who will see that email immediately and forward it to the correct person to answer the specific question that you might have. We have a protocol where we are supposed to respond during the week, Monday through Friday, 9 to 5, respond to that email within 2 hours. We do our darndest to do that. If it's exceedingly busy, that time frame might slip. Many of you might also know that you've emailed on a Friday night or a weekend and you've gotten a response within about 30 seconds. So we try as best we can to respond really as quickly as humanly possible. We don't have the luxury of, we don't have operators who sit and just wait for people to call. Everyone's busy doing all different things, and everyone pitches in to help you help you with whatever you need. I want to let people know that we have a new phone system that went live last Friday, that if you have called in recently and had an excessive wait or was passed around, I apologize. Trying to tweak the system, give you better service, and I think there are some settings that we're needing to fix and wanting to improve, so bear with us while we do that. Hopefully we'll come out of that in the next few days with a really great phone system. Would it be possible to have one contact? Certainly, if you have a favorite person and you want to continue to ask for that person, I encourage it. I can't guarantee that one person will always be available when you need, because, again, we're a small company and everyone is wearing many hats and working hard and doing the best we can. Okay, the next question comes in from Stanley. He has a number of questions. It's primarily about masks, and I think it represents questions that a lot of people have. So a mask should comply with form, fit, and function. I've had at least 3 different types of masks. I've been fitted with large and medium and small. The Amara mask, which is the one from Respironics, which was the upgrade, is the best so far, but it still has problems for me. I have to keep the straps so tight they're uncomfortable, and they leave marks on my face and forehead and put pressure on my nose, and it often wakes me up. So his question is, why is this? Why can't your clinicians fit me with a mask that will fit my facial structure so I won't have to have it so tight? I'm going to open up the lines here. I would sense that there are a lot of people who feel like the mask never fits quite right, and they have to constantly fuss with the straps, and every once in a while it gets tighter and tighter to the point where it's uncomfortable. Show of hands, I mean, is that a common issue that I hear from everyone?
Yes. Yes. Yes.
Yes. Yeah. So I wish I had a magic bullet for everyone. I wish I had a magic answer. There are a number of different types of masks. As you know, there's a nasal mask that fits over your nose. There's the nasal pillow with the prongs that sort of fits in your nose a little bit. And there's a full face mask that covers both your mouth and your nose. And everyone's faces are so different. I actually, I don't know if people know this, but I'm an engineer. I'm a mechanical engineer by training. And before I started National Sleep Therapy, I was working on the development of new CPAP devices and new CPAP masks. The new CPAP devices were easy compared to trying to come up with or develop a mask that would fit everyone comfortably. It's an enormous challenge, and I think it's almost an impossible task. And, you know, it's really everyone's role. It's yours and it's ours to help you find the right mask. And I don't think there's going to be a perfect mask, or at least one mask that's going to fit everyone. There will be some trial and error. And the best mask for you might be the least worst mask. Again, I've helped patients bend them with hair dryers. We have Ramsey liners that are silicone pads for users that go on across the nose for people with, you know, as you get tighter and tighter, you know, your skin gets pushed on and there's less blood flow and it's more prone to getting irritated and having sores or even cuts. Sometimes those silicone pads or the cloth Ramsey liners. Doreen, remind me of the silicone pads, the name of those pads.
Gecko pads.
The gecko pads. Thank you. So those silicone gecko pads, for a lot of people, do absolute wonders. We've had a lot of people ordering the Ramsey liners, which are they come for the full face mask, and they come for the nasal cushion mask, and they're thin little cloth liners that go between the cushion and your skin. And some insurance companies, or many, will pay for those. Just so you know, if you have Doreen, correct me if I'm wrong, if you have a full face mask, they will pay for those in addition to your cushions. If you have a nasal cushion mask, you need to substitute out some cushions for some liners. So if you have any questions about this, you can call us and we'll walk you through it, but we're having super luck with these silicone gecko pads on the nose and the Ramsey liners between the cushion and your skin. Doreen, did you want to add something there?
In any situation, with a full face mask or with a nasal mask, it would take the place of a cushion because it's the same billing code. Okay. So, for instance, in an order, we would typically send for a full face mask 3 cushions. So what could happen would be you would get a package of Ramsey liners and 2 cushions, or 2 packages of Ramsey liners and 1 cushion, depending upon what worked best for you. So it just replaces a cushion.
So thank you for that. In terms of, so if you're interested in Ramsey liners, which are the cloth fabric or the gecko pads, give our office a call. They'll help you figure out what gets paid for what and tell you how much it is, and they know that stuff. In terms of the tightening and the straps, and one thing to keep in mind is these straps are cloth-covered neoprene, and they stretch out quite easily. They're on your skin. They're warm because of your body heat. They're staying tight for hopefully 8 hours a night or more. If you're like me, I only sleep 5 or 6 hours a night. But in any event, they're being stretched for a long time, and they do wear out, and you might find yourself having to go tighter and tighter. But that's not the only reason. A lot of people feel that they need to strap the mask on tighter to stop the leaks. Now, in theory, again, having been in mask design, we tried, and Respironics and ResMed and Fisher & Paykel also tried to design cushions where you shouldn't have to strap it on too tight. The pressure inside your mask, they designed the cushion so the pressure inside your mask actually pushes the thin flange of the cushion against your skin, and it's supposed to seal. Now, that might be a good theory on, a plastic model, but we all know that our faces are all different shapes, and it doesn't always work. I would say that if you feel that you need to really cinch those straps so tight that it leaves marks on your face for hours and you're getting skin breakdown or skin issues or even lesions and open sores, that you should talk to us and let's see what other options there are. The option might be something with a liner or a pad or something different, but it's worth talking to us about. Okay, so let's move on to another question. This one is from Norman, another Norman. I'd like to know if there are more masks to choose from. The Quattro FX I have leaks air fairly frequently. Again, this is a full face mask. There are other full face masks on the market. There's the Amara from Respironics that we've had good luck with. There's the Forma from Fisher & Paykel that actually sits below the chin if you're a mouth breather and you want to keep your mouth closed. The Forma is a nice mask for that. And really, it's personal preference, and you almost just have to try these masks. And I understand that the issue with trying masks is it can get expensive. And after 30 days, so for most people within 30 days when they've received their equipment, we're able to swap masks in and out at a reasonable number, and the manufacturer lets us do that. Beyond 30 days, it becomes a payment issue or an insurance coverage issue. And some insurances will pay for you to try different masks, within the first 60 to 90 days. Some won't, and you have to pay for them yourself. So here's where it gets complicated, because these masks are not cheap. They're, between $100 and $175 a piece. Insurance pays for some or doesn't pay for some, and we want to help, but we can only help within the confines of what insurance covers and what you're willing to pay, and if we have samples and we can help, et cetera. So call us if you're having serious issues. We'll see what we can do. We're doing the best we can, but the number of masks out there is limited. It's changing, but it's probably not changing as quickly enough for those of us that haven't found the perfect mask yet. So on to the next question from Charles. And I have to say, a lot of the people who wrote in, I know well, I've spoken to, I've emailed before, so it's nice to see familiar names. From Charles, are the Medicare usage requirements the same after 90 days? No, they are not. In fact, Medicare does not require us or anyone to monitor your data after 90 days if you have met their adherence guidelines and we have received your face-to-face office visit notes. You are basically good to go. Medicare will continue coverage for the rest of the 13-month rental without any need for continued data. It's within the first 90 days only that you need to meet their adherence requirements that are quite strict. Is there anyone on the phone that is within that 90-day Medicare trial?
I am. Yeah, this is Charles.
Okay, Charles. So the requirements are, it sounds like the rest of you are veterans and have successfully made it through that trial. You know that you need to average 4 hours a night over 70% of the nights over a 30-day contiguous period before 90 days. I know that's a mouthful.
Yeah.
And I remember, Charles, I seem to recall you're doing well. But after 90 days, everyone, the requirement is no longer there, and we're not required, and you don't need to keep track of your data. Really, we can look at that. Your doctor can look at it and try to head off any problems, but other than that, Medicare doesn't require it.
Can I ask a question, please?
Of course.
Okay. My name is Lynette, and I'm asking because recently I've taken my CPAP machine to my pulmonologist. I hope I said that right.
Yes.
And they take the SD card out of the machine and they track whatever data that they need to track. And because of the hours that I work, I usually get about 2 good hours of sleep, but I'm using the CPAP machine each time. So the concern with the lung doctor was that my machine would be returned back to the company. Is this something that happens regularly, or it just won't get returned back to the company?
Yeah, unless you have. So that's a good question, Lynette, right?
Yes.
And I encourage you to email me after this, and we can talk about it more offline. I don't know if you have Medicare or not, but there are other insurance companies who are starting to follow Medicare guidelines, and some of them, even after 90 days, require proof of usage and adherence, even for the resupplies.
Well,
I don't know.
I'm sorry. Actually, I'm not a Medicare recipient. I have Aetna as health insurance, and I just wanted to make sure that with that particular insurance and with your company that this won't happen to me.
Why don't you email me after, but I don't believe there are any Aetna policies where after 90 days, if you don't continuously use it, that will take it away. I don't think that's the case.
Okay.
Primarily Medicare, Harvard Pilgrim, maybe one or two others have a 90-day, what I call use it or lose it policy. But usually after 90 days, they've approved it, and you're sort of in the clear, you're safe.
Okay. Thank you so much.
You're welcome. So I'm going to move down to a question from Loretta. Using your CPAP machine religiously every night, I still don't feel that refreshing energy. Sometimes I still feel like tired and my lungs are sore. And in cases like this, I would highly suggest, and I have suggest to Loretta that she contact her sleep doctor or pulmonologist. The CPAP machine does a few things. One, it keeps your airway open, and its sole intent is to keep your airway open so you can breathe without stopping breathing. Of course, everyone knows that apnea means lack of breath or stopped breathing. So if the CPAP machine can keep your airway open and keep you breathing, it means your oxygen levels stay higher and more consistent. So that's sort of doing two things. One is it keeps you breathing, it keeps your CO2 levels appropriate or keeps them in the right range, and it keeps your oxygen levels in the right range. And I hear a lot of folks saying, it's the best sleep I ever had, it changed my life, a lot of wonderful things. If you still feel like you're exhausted during the day, memory isn't any better, you're still grumpy, well, I guess that goes for me and a lot of people, but if you're just not feeling it, if you're not feeling any change in just your overall perceived quality of life, I would highly suggest that you talk to your doctor about that, have him or her look at your data. There could be a whole number of other reasons that the CPAP machine could be doing its job wonderfully, and there might be some other reasons why you're not feeling as energetic and terrific as you should. So with that, I would just suggest that it's an excellent question for your doctor. We get quite a few comments about the humidifier. All of our machines come with that humidifier chamber on the right-hand side, which is really a comfort feature. As I mentioned, for traveling, or if you don't like it, you can disconnect it. On the bottom, there's a little latch that you pull and it disconnects. But it has a relative humidity setting by default, which means it detects how much humidity there is in the air at the time, and it adjusts how much water it evaporates into your breathing circuit. And you might have some days where you just go through the whole tank of water, and some days where you only go through half a tank of water, and you can't figure out why. But the answer is probably the humidity in the room has changed because it's probably in a relative humidity mode. In some of the newer machines, you can put it into a classic mode where it's not relative humidity. It's just as much humidity as you want to dial it up, so you can control how much it is. So that's the way those work. There are some times when you might get some water in the hose. That's called rainout, and that's when the surface temperature of the hose is cooler than the temperature of the air that you're breathing in and out. So the water actually condenses and forms water droplets on the inside of your hose, as opposed to sort of being breathed in and out and going out of the machine. So in this case, with the heated tubing, with the newer systems, it has heated tubing. It does so the water droplets don't stick to the inner wall or condense on the inner wall. If you don't have heated tubing, the solution is to either put one of those hose, I call them a hose cozy. It's like a sock for your hose that basically keeps the heat in, keeps the surface warm, keeps it from condensing. Or a lot of people just tuck the hose under their covers to keep it warm, and that usually does it. The other thing is make sure that if you're getting rain out or water in your hose and it's coming into your mask, try to put your machine lower, more near the floor of your bedroom or wherever you're sleeping to keep the water rolling down. There's a question here that I get all the time, and I was going to skip it, but I'm not going to skip it. The outrageous cost of supplies. Would people like to hear the answer to this question?
Sure.
So one thing to keep in mind is, one thing you'll see is on your insurance explanation of benefits, you might see a charge, or you might have seen it on your order from National Sleep Therapy on your original delivery ticket. It's the charge that it's like a manufacturer's suggested retail price. And then you'll see the allowable charge, and that's the charge that the insurance company actually pays. And let's just take an example. There might be a mask where the manufacturer's list price is $225, and the allowable price is $110. So the insurance company pays our company $110, regardless of what we put as the manufacturer's price. So we could put that mask was $5,000, and they would pay us $110. We could say that mask was $112, and they would pay us $110. And they pay everyone the same exact rate. So that's it's always going to be the same amount. And is the cost outrageous? I guess that's for you to decide. These components are made out of special silicone materials. As an engineer, I know that the plastics are very highly controlled. They're made in sterile environments. They're sort of fancy materials, and they have to be tracked by serial number. It's not like buying, a plastic shovel from the hardware store. It really is a carefully designed, carefully controlled, manufactured product. Most of the product is made in developed countries like the U.S., Australia. This is the real deal, and plus you get basically free support. If you buy a mask and you need to talk to Doreen 3 or 4 times to help with the mask, guess what? That's all for free. And I think that's a pretty good deal. So I just wanted to put in that plug for supplies that when you really sit down and think about it, they might look expensive on the surface, but what the insurance company ultimately pays and the level of support I hope you think is good that you get, hopefully it all works out well. I'm going to mention one more thing about, actually I'm going to go down to the next question. Do the cotton face mask liners work? This is from Barbara. Those are the Remzi liners. And Doreen, you probably have the most experience with people who are using these liners. And if you haven't fallen asleep on the phone, maybe you could shed some light on how people are working, how it's going with the Remzi liners.
I think it's depending upon what problem you're trying to solve. I think they work very well in combination with getting an appropriate mask fit. If you have an ill-fitting mask or a mask that's the wrong size for your face, then the Remzi liners may not be able to solve that problem. But in combination with the right mask, it makes a lot of folks a lot more comfortable and does solve a host of problems, as do the gecko pads.
Eric?
Yes.
Hi, may I ask, this is Loretta, may I ask a question that kind of coincides with the humidifier portion of the machine?
Sure.
I've got the humidifier turned all the way up to 5, and yet I still wake up with a very dry mouth. Is there anything that can correct that? I don't know, of course, and my mouth is dropping open while I'm sleeping. I've tried the head elastic strap that's supposed to keep your mouth closed, and it's just not working.
Yeah, that's a good question. There could be a number of reasons. Either it's in relative humidity mode and it's just not delivering enough humidity for you. It could be that you're mouth breathing and you're just, no matter how much humidity we put in there, you're going to dry out. The chin strap might not be working. I would suggest you can call Doreen, you can call any one of our clinicians, and maybe you've done this already. We might want to try it in classic mode. We might want to try a different mask, maybe the Forma that keeps your mouth closed better. There are some things we can try, and you may have tried everything under the sun. You may need to put a humidifier in your room. During the winter especially, when it's really, really dry, it's not uncommon. During the summer, it's not uncommon because people have air conditioners that pulls all the humidity out of their rooms. So I suggest you give us a call and we can really walk through this carefully and see what's happening in your room, what time of year, and what the options are.
Okay, thank you.
I just want to interject that sometimes looking at your data would give us a clue as to, what was going on with your mouth and if that was an issue. And I have had a lot of patients recently have very, very good luck solving that problem with the addition of a room humidifier. So I'd be happy to talk to you tomorrow if you'd like to.
Okay, that was Doreen?
It is, yes, ma'am.
All right, thank you.
You're very welcome.
So I have 3 more questions that I want to get to quickly because then I want to open it up. I realize we're going to run late, and I apologize for that. We only have one person to blame for that, and that's me. So the next question from Penny is, why do you recommend new equipment every 6 months? I wash things carefully. I don't see why we could go longer before changing out the equipment. And absolutely, there are some parts like the humidifier chamber where we actually don't recommend changing every 3 or 6 months. They can probably go for a year as long as you keep them nice and clean. It's kind of a hard plastic. It's easier to clean. Some of the other parts that go against your face, the oils and the dirt and the bacteria do start to embed themselves in the surface of the material, especially those silicone liners. If you look at those under a very good magnifying glass, if you have the luxury of having a microscope, which everyone should have a microscope. It's a fun thing to have. Put it under the microscope and you can see the tiny surface imperfections and things will get caught in those. We actually recommend replacing things more frequently than 6 months. Typically send out a new shipment of supplies every 3 months that might have 3 cushions, 3 full face cushions, or 6 nasal cushions or nasal pillows. Do they need to be that frequent? I've seen some of the cushions that come back. Unless you are exceedingly diligent and you're scrubbing and such, you're going to get residual oils and things on those masks, and it could cause skin irritation. That's one thing. Again, these materials aren't designed, they're designed for performance. They're not really designed for longevity. And the materials will soften. They will start to not hold their form and therefore holding their seal. The plastic mask, the stiff clear part, could that last longer? Probably. I should say definitely. But we can't sell it separately, which is a shame. The other part of the question, or someone else said, should I just throw away these other things? What should I do with them? I would keep a mask or 2 on hand as a backup if you travel or one gets damaged. The used cushions, the nasal cushions, the full face cushions, especially the nasal pillows, unfortunately, there's not much you can do with them. No one's taking donations for used medical equipment. They really just need to unfortunately, go in the trash. A couple more. This is from Janet. Handle power outages. We get this call a lot from people who go camping, people who, we have a customer who lives in a solar panel, in a solar house, which is fantastic, and we help make sure that his solar panels could power the CPAP machine, which actually takes very little. You can buy a battery from Respironics. It comes with all the cables and the kit. It's not inexpensive. It's hundreds of dollars. If you have a marine battery or a car battery, any normal, 12-volt battery, it's a 12-volt system. The CPAPs run off of DC power. So if you have a battery, you can actually get a cable from us, from Respironics, which has 2 alligator clips to go to the positive and negative terminal of the battery, and then plugs right into the machine, and you're off and running camping. You can also get a cigarette lighter adapter to power it. You just want to make sure that if you're car camping, you don't want to do that for days without starting your engine and recharging your battery. Otherwise, you ain't getting home. You might sleep well, but you're not leaving the place. So just make sure your battery is charged. The last question that everyone asks, are there alternatives to CPAP? There are, but most people who have obstructive sleep apnea have it for a reason that is not curable yet by other means. Some people have gone through surgery, which has a fairly lower success rate than CPAP. Some people have tried mandibular advancement devices, MADs, which is like a bite guard that moves your lower jaw forward, which has its side effects and issues, but can help some. Some people have tried ProVent, which are those little stickers you put on your nostrils. They have little valves in them. creates a back pressure. I have tried those. I had trouble using them, but there may be people who that has worked for. The jury's still out on how that works with obstructive sleep apnea. But I'm all for, if you want to, I wouldn't discourage you from researching and trying, but currently those are the CPAP still is the gold standard. That could change in the next few years with new technologies, but at this point in time, for obstructive sleep apnea, CPAP is still the number one therapy. With that, if everyone is still awake and ready, if they have other questions, we can open it up and we can try to answer them as best we can.
Yes, this is Paul. You had mentioned in your talking earlier about the Medicare, the 3 months, and then you mentioned that 13 months. I'm on Medicare, and I've been using a machine for more than 13 months. Just wondering what that 13-month is.
Oh, okay. So the 13-month number is Medicare pays for an initial 3-month trial as a rental, and the 13 months is the total rental payment period is 13 months. So after the 3 months, they rent it, they pay by the month for another 10 months for a total of a 13-month rental, and then you own that machine.
Oh, really?
You own it outright after the 13-month rental.
Uncle Sam paid for it.
Uncle Sam paid for it over 13 months. We give them a little payment plan. Actually, they require we give them a payment plan. So that's what that 13 months is.
Okay, thanks.
You're welcome. Other questions?
I take my mask off at night, and I don't know it.
And is your question how to try to make sure you keep it on?
Yeah, or have a better alarm system so that, I would hear something. There's like a little faint tone, but that doesn't do it.
Yeah, and Doreen, you might know this better than I would need to look at which machine we're talking about, but there is a large leak alarm. Maybe that's going off, but it's not loud enough to wake you up. Is that it?
Right.
Yeah,
I'm wondering how long you've been on your therapy.
Oh, a couple of years, 2 or 3, 4 years.
Oh, okay. Because generally that can be a problem initially when people are acclimating to their therapy, but for some patients, as they continue to wear the therapy, it's kind of muscle memory. Their body gets used to having a mask on their face, having that pressure in their airway, and for some patients, they acclimate to it and stop taking the mask off. It doesn't sound like that's been your experience, though.
No, apparently not.
I would suggest that it sounds like there's more to talk about than we can in this call, that I would suggest you call our office and ask to speak with one of our clinicians, or if you want to speak with Doreen, ask for Doreen directly.
Okay, thank you.
Yeah, you're welcome. Other questions? I'm happy to go all night. It depends on everyone else, how long you want to stay on and how many questions.
This is Jack with a question. You answered it a minute ago, but I'm not 100% sure I understood it. After 13 months, we own the machine and there is no additional monthly charge. Is that correct?
For Medicare, that is correct.
Right. What about if there's a need for a repair or anything with the machine?
So I know that machines are warranted for, I hope I have this right, I believe it's 2 years.
Right.
I would need to look into repair costs or repair, what insurance pays for repairs outside of that warranty period. Typically what we do on a warranty is we'll either send you a new machine, exchange it under warranty, or if it's out of warranty, we can have it repaired. Usually the flat is something like $200 to repair a CPAP machine. But if you are having a problem with a machine and it's in or out of warranty, you should give us a call. And
I'm not. I was just anticipating, and I guess the question was if it broke down beyond the warranty period, could we go back into the 13-month rental again, or is that not allowed?
No, you don't go back into the 13-month rental. We'd have to see what your insurance policy covers for repairs that are out of warranty. Everyone's insurance policies are different, unfortunately, but and some insurance companies allow you to get a new machine after 2 years. Medicare, it's 5 years. They expect the machine to last 5 years before you're eligible for a new machine. Some of the commercial insurance companies, the Aetnas, the Uniteds, for example, may have a 2-year policy, so after 2 years, you're eligible for a new machine.
Okay.
So those are things to think about.
And the final question, the tubes. How often do we need to replace the tubes, and is it just as easy to just rinse them and clean them, or do we need to replace them every 6 months or so?
The tubing, your insurance company typically pays for new tubing or new hose every 3 months. Personally, I've seen hoses cut open, even though they were kept fairly clean. You can get some lingering stuff in there, so personally, I would replace them every 3 months. If you're super diligent, maybe 6 months, but it's kind of your call. But the hose is where humidity collects, and there's warm air, and I tend to be conservative. I'm conservative with that kind of stuff, so that's my opinion.
Thank you.
Other questions?
Yes, I have a question. This is Parita. A follow on to the last caller. How long does Medicare provide supplies beyond that? When the machine is final or finished the rental, how long do they continue to send you your supplies?
Good question. Most healthcare plans, including Medicare, after 90 days will pay for a new set of supplies every 90 days or every quarter, 4 times a year.
Mm-hmm.
With Medicare specifically, you need to approve your shipments. With most other plans, that's not true.
Uh-huh.
We can have an auto supply program, and we can automatically ship you things every 90 days.
Mm-hmm.
With Medicare, we need to make sure that they should be replaced, that their functionality should be better, and you approve them, and they will pay for them every 90 days.
Okay. Now, who does this approving? You guys, or your doctor, or what?
No, we do. So
okay.
You approve it. We will either call you, or there is a way that with Medicare, we need to call you within 10 days before the shipment is ready to go. We will either call you, someone like Doreen might call you, or we have an automated caller that will call you and say, hi, my name is Jessica. I'm calling to get your approval for your shipment. Say yes if you approve your shipment, and it will be sent off within the next few days. So that automated caller, if you get a message, you can call back any time, day or night, and leave a message. It makes it really easy for you to approve your shipment.
Thank you.
You're welcome. Any other questions?
Yeah, this is Gene.
When I had a card downloaded at one of your facilities,
yeah.
Do you share that, when you get that information, do you share that with anybody else? With my doctor or something like that?
Yep. So in regards to data, data that we collect either by the SD card, as this gentleman mentioned, or if you have a wired or wireless modem, the data goes into a central database that only National Sleep Therapy and your doctor, and if your doctor is part of a sleep lab, but if they're not, it's just National Sleep Therapy and your doctor can automatically see that data. Goes into a database that's accessible. It's highly protected, but it's accessible online, so both National Sleep Therapy and your doctor can see that data. The other thing we do is any notes. If we talk to you and we talk to you about something that you're experiencing, we also put those notes with the data, so when the doctor checks in your data, he or she can see if there are any issues that we've uncovered, and that way it's a little bit more seamless and you don't have to explain everything all the time. Did that answer your question?
Yes, thank you very much.
Oh, you're welcome.
Eric, this is Paul from Alexandria, Virginia. I just want to put in a plug for Doreen and tell you how great she's been in answering emails and phone calls and crazy questions for me, so thank you, Doreen.
Oh, you're very welcome. Always my pleasure.
I've got 2 questions real quick on considering the monitoring, Eric. I'm one who likes to check every morning or so, how many nights and how many hours and things like that. Two readings on that, though, confuse me a little bit. And one of them is AHI, the apnea/hypopnea index, and the other is periodic breathing. The AHI for me has risen over time, and I've been on a full face mask for almost 2 years now, but I have a reading now of 10 per week and 9 for 30 days. And then the periodic breathing comes through at 1%. Does that mean I'm experiencing episodes, and should I be concerned with that?
Good question. So AHI is the apnea-hypopnea index, and one of the basic functions of the machine is to reduce your AHI, right? Your AHI is your indication of how many times you stop breathing per night, your apneas. There's different doctors have different thresholds of what they think is an acceptable AHI. If you had your sleep study and you had an AHI of 120, which is not uncommon, and the CPAP has brought you down to 6, 8, 10, your doctor might say, that's relatively terrific. If your AHI was 15 and it's only down to 10, your doctor might say, maybe we can do better. The periodic breathing, I'm not a doctor and I don't want to diagnose, but periodic breathing is sort of a waxing and waning of your breathing. It's this crescendo, and then it slows down, and then there's quiet time, and then it crescendos up again. Again, that's something that if you're noticing it, I would bring it up with your doctor and see if he or she can explain it, what's best for you. But in terms of AHI, I wouldn't think that a call to your doctor to say, hey, my AHI is creeping up. It was started at 6 and now it's at 10. Why do you think? I don't think that's an unreasonable thing to do.
Great. Thank you.
You're welcome. Doreen, do you have anything to add to that?
Well, the analogy I like to use for patients is if you were driving your car down the road and occasionally your engine made a little knocking sound, you wouldn't be inclined to ignore that. You'd be inclined to mention it to the mechanic. Could it be something that needs fixing? Absolutely. Might it be just the cork of your car? Perhaps. So, your doctor is working in partnership to make your health care the best that it can possibly be. So it is always reasonable to bring those kinds of observations and concerns and changes in symptoms to his or her attention.
Thanks, Doreen.
You're very welcome.
Questions? I'm sorry, other questions?
Yes, this is Gene from Georgia. I have occasionally, maybe once a week or something like that, awakened in the middle of the night and my throat is absolutely dry. And I'm wondering what I can do, if anything. I mean, it's not, I'm not in danger or anything like that. I just swallow a couple of times, push my tongue around, and it works out fine.
Yeah.
But I don't know what causes it, and should I be concerned about it?
Yeah, it's a good question. And we talked a little bit about humidification. It could be that you just need more humidification. It could be that you're a mouth breather and you're getting so much air in through your mouth or your esophagus that you're just drying out. It could be that your room is excessively dry and the humidifier just can't keep up. It's a combination of things. You might need to humidify your room. Again, in the winter, if you're in a cooler climate, in the winter it can be excessively dry. If you're in a warm climate during the summer, it can be excessively dry from the air conditioning. In those times, you might need to get a little $30 humidifier from Target and keep that in your room. And in addition to the CPAP setting on high, you might want to go into classic mode and just drive as much humidification as you possibly can and see if that helps, and then start from there.
Okay. Well, I turned it up to 4, but now I'll go up to 5 to see how that works out.
And again, you might need supplemental humidification in your room.
That's good. Okay.
Yep.
Thank you very much.
Good luck with that. Other questions? Should we take one more and then call it a night? And then I'm going to ask people if they thought this was worthwhile. But let's take one more.
Eric?
Yes.
Hi, this is Loretta. Along that same line with that gentleman's question, that is what I am experiencing. Let's put it that way. But if you could explain to me what classic mode means?
Sure. And Loretta, I would need to look to see what kind of machine you have. but the Respironics System 1 machines, and Doreen, you can correct me if I'm wrong, they have a relative humidity setting where they actually sample your room air to see how much humidity there is, and it adjusts the humidity based on that.
I do believe that mine does that because I've noticed if I'm in a high humidity location like on a cruise ship, I use practically no water out of the reservoir at all.
Right. So that makes sense. There is a setting where you can basically turn the humidifier setting off, which puts it into classic mode, which doesn't sample the outside air. It just delivers as much humidity as you set it to without even looking at the outside air to adjust.
All right, I'll call Doreen again tomorrow and see if we can.
Yeah, we'll have to see if your machine has that classic setting and show you how to get it into that mode.
All right, thank you.
You're welcome.
But Eric, there's nothing therapeutic about using the humidifier again, right? I mean, I turn mine off because I just don't like the hot, moist air. It's like breathing your own exhale, which you do a little bit anyway, but I've just found it more comfortable for me to have the cool air going through, but I just want to make sure that I'm not sacrificing any kind of therapeutic thing by having it turned off.
I don't believe so. It's a comfort setting. Most people like it because what Loretta just described and the other fellow described, which is they get dried out. But if you're not getting dried out and you're comfortable and you're benefiting from CPAP in terms of preventing apneas, I think you're good to go.
Okay.
Yeah. So with that, I want to thank everyone for joining in. I will try to reschedule it because through my clumsiness, I probably prevented people from joining in by sending out the incorrect code. But I guess I'll ask for the few people who are remaining, is this a worthwhile thing to do on a periodic basis?
Yes.
Absolutely.
Absolutely, yes.
Yes. Enjoyed it very much, Eric.
Yes.
Yeah,
yes.
I'm inspired to do better.
Well, that's good. That's terrific.
Stand by for a long email.
What's that?
Stand by for a long email.
I love getting emails because, I'm able to really read them a few times, and so I encourage it. One thing I do want to mention, and I have to mention, is our email system, as most normal email systems, are not secure. So I just want to let people know your emails that you send or we send you could be intercepted. We work very hard not to send detailed customer information. We'll never send financial information like your credit card numbers by email. For HIPAA reasons, we make sure that we don't send a lot of detailed information about you and your condition because, God forbid, the wrong person could get the email or they could be intercepted. But if you send it to us, I just want to be clear that it's not secure and anyone could see it if they were so inclined to hack into your email system.
Understood.
Okay. And assuming those risks, we love getting emails. So reach out to us as much as you need. We're here to help. I hope this conversation was helpful. I'm glad to hear it. It was encouraging to help you do better. We love doing this. I personally, as the founder of the company, love meeting all of you directly, and that's what makes this job so special. So